Okay. Well, good afternoon, everybody. Thank you so much for joining us today. My name is Stephanie Turner, and I am a marketing specialist here at Crow and Dunlevy. We're glad that you're with us today. We want to give a special thank you to the members of the Lawton Fort Sill Chamber of Commerce. Our new friends there, Sylvia Burgess and Brandy Sims, really helped us with connecting with you all and pushing this webinar out to you guys. So we're really excited to connect with you all. Just a couple of things I wanted to share with you. Madalene Witterholt and Mary Snyder will be joining us here in a second. But please take note, if you do have a question during the presentation today, you can submit it through the Q&A box down there at the bottom of your screen. I think our presenters are going to plan on answering as we go. And if we miss any questions, or if you don't get to ask us today your question, please submit them to us at info@crowanddunlevy.com. Also, if you want to learn more about our legal advisories or our seminar invitations that we'll send out in the future, you can sign up by subscribing to the Labor and Employment Practice Group on our website. Just fill out our quick contact form, and that's a great way to stay up to date with all of our latest legal developments and our event invitations. So we look forward to connecting with you. So without further ado, I want to send it to our first presenter today, Madalene Witterholt, and I'm going to switch chairs here with Mary Snyder. So again, thank you so much for joining us, and we hope you find today's presentation very educational.
Hello, everybody. This is Madalene Witterholt, and my friend Mary Snyder and I from our Oklahoma City office are going to try to make technology work here as best we can. Let me do a little introduction of, there's Mary's picture. She is an attorney in our firm's Oklahoma City office, and she is in our Labor and Employment Practice Group, and she actually practiced law in California, which is next to Florida and New York. Well, probably is the scariest employer's realm that there is. And so we're certainly glad that Mary was able to join us a few years ago, and I'm certainly glad she's my partner. Now, here's a picture of me. Don't care about me. Okay. That was pretty quick, wasn't it? Yeah, I'm out of the Tulsa office, and like Mary, we don't do anything but labor and employment law unless, I mean, we're litigators, so if you had something else you need us to do. But basically, this is what we do 24/7. And as we pointed out at the beginning, you can send in Q&As now, or if you think of something later and I've confused you, which there's about a 95% chance that that has happened, then you can go ahead and email me or Mary or anybody else in the practice group. Just put RE seminar in the topic section of the email. And if you want to know how to find our email besides looking at the last screen, just go to the Crow and Dunlevy website and click on our lovely pictures. So without further ado, let's talk about protecting your workplace from COVID-19. And for those of you that may have heard me speak before, it's very hard for me to use a PowerPoint. So I'm going to show you some pictures now. There are 3 things that I think you're supposed to know about COVID-19 and safety in general. 1, clean your hands, wash your hands, you have hand sanitizer available at your house, in your car, and we'll talk about having it provided at work. Second of all is the mask. The mask doesn't necessarily, oh, look at Mary. The mask protects other people from you. And so if 2 people have on masks, they're protecting each other. So masks are very important, and we're going to talk about them too. And third, social distancing. Now, I know this is the closest 2 people I could come up with. These people are not 6 feet apart. They would have to be over here to be 6 feet apart. The best thing to do to see what 6 feet apart is for my little friends, pretend this is a yardstick. Take 2 yardsticks and make X's at the ends of them. So we got our 3 things. We got keep yourself clean, have hand sanitizers, mask. I actually rode in a car with a friend of mine for 40+ years, and she wouldn't ride in the car without a mask with me. So that tells you how lucky you are on the other side of the screen. So you've got the mask, the hand sanitizer, and social distancing. So let's go back to what we came here to see, which is what do we know so far about protecting our workplace from COVID-19 issues, and what the heck are we supposed to do? And that's a very good point, because obviously, at least in our lifetimes, even mine, as old as I am, I missed polio. So we're not used to having to deal with this. And so we don't have plans in place. Now, God forbid we have another pandemic, I think we'll all be prepared. But at this point, we're getting prepared for the next one, and hopefully we'll stop the spread of this one. So how do we protect our workplace from COVID-19? I just think that the worst thing about COVID-19 is that they make this COVID-19 little virus look so pretty, but it's not pretty. In case you don't know, because the virus that causes COVID-19 is people to people. Although sometimes people say don't play with your cat if they've played with a sick person, but okay, it's people to people, and this is the ew part, respiratory droplets produced when an infected person coughs, sneezes, or talks. So obviously, you're going to want to do what you can to prevent respiratory droplets getting in you from somebody else. That's where the masks and the 6 feet come in. And even grosser, yes, they can land in your mouth or your nose. They're starting to figure out, although the rules seem to change every 5 minutes, that you can't, that the stuff doesn't stay on your on hard surfaces as long as they thought it did at first. But I'm not taking any chances. I'm cleaning everything. And of course, as we just said with our two little friends, spread is more likely when people are closer to 6 feet. So this is what we know about the virus. And it's funny, it's pretty much what we've always known about viruses and the plague and everything else. So what do we want? What does OSHA do about it? Because, OSHA certainly wants to do as much as they can to keep American workers safe and to terrorize, I shouldn't have said that, and to impact the employers of America. And so because of the short time frame, they took a couple of different things they already had in place, and this is how they're going with the COVID-19 and protection of employees. They're going with the general duty clause. Everyone knows there's a general duty that everybody has a safe environment, free from recognized hazards that could be bad or are bad or could cause harm. And so what they've done is OSHA has said, we take the general duty clause in conjunction with the CDC guidelines and we meld them together. And that's how how OSHA gets into the idea that we have to have written plans in place to limit COVID-19 exposure at work. So what we're going to do is we're going to look at limiting it, as we've just talked about, and then planning for the limiting. Now, certain different types of protections are relevant to certain kinds of jobs. PPE is still PPE. And if you were already using PPE, gloves, eye, face protection, respirators, you still need to use those. When respirators are necessary in general, you've got to implement them. You've got to keep that program going. There seems to be a little bit of a wiggle room on fit testing for respirators, but I personally would just keep what I was doing and do it as fast as possible. And then there's our friend, the bloodborne pathogens. For those of you that are much younger than me, there was a time when we didn't know that blood flying everywhere was a bad thing, or at least we didn't have the bloodborne pathogen standard. So they are considering COVID-19 respiratory secretions the same, kind of the same requirements as you would have under the bloodborne pathogens, bodily fluids being the first thing. Now, of course, since we don't have things like COVID-19 in the Bloodborne Pathogens Act, they are analogizing them to bodily fluids. Now, what do I do? Do I have to report if someone gets COVID-19 on my OSHA log? And that's the first question everyone asks, because no one wants an OSHA recordable. Now, if it's reasonably work-related or related to the work environment, you would record it as an infectious disease. And we're going to talk about how we know if it's reasonably related. And OSHA seems to be indicating that, gosh, just because you had someone who got COVID-19 at work doesn't mean that they're going to cite you for a violation. But you need to have a plan in place, and you need to be sure the plan is working. Oh, look at that. Here's some examples of what OSHA thinks would be evidence of a person's COVID-19 being work-related. Several of your coworkers have COVID-19. So Mary has COVID-19. She and I work in 2 cubicles apart. I get COVID-19, and there's probably a reasonable suspicion that my COVID-19 came from work, unless I could prove that everybody in my family had COVID-19, and thus Mary probably got it from me. Anyway, when an employee works closely with a particular customer, and that customer has a confirmed case of COVID-19, and this especially applies to outside salesmen, receptionists, people working in retail, which brings us to, for anybody whose job requires them to be out in the general public, which would be, in my mind, waitresses, waiters, Walmart employees, Neiman Marcus employees, even though they filed for bankruptcy, they're still out there. Fast food employees, they're in close contact to the general public. If you can't come up with a better reason that they didn't get COVID-19 from work, you're going to have to assume that's work-related. And then, of course, they say, on the bright side, if it's not likely work-related, if you don't have any of the above exposures, like you're sitting at home in your pajamas and you get COVID-19 and you're not around any of your coworkers and you don't go out of the house for 6 weeks, then it's not going to be work-related. So seems pretty simple. If you determine it's not work-related, then you do not have to put it on your OSHA 300 log. I would strongly urge you, like I do, and I'm sure Mary would urge you the same way, that when you have something like COVID-19, when you do your 300 log, you want to leave the employee's name blank, whether you have a code number for them, or the last 4 digits of their social, or their secret employee number. You just code it as a respiratory illness, and you go from there. So now, let's say you've had, let's say that you've had a COVID situation. Well, if you have a work plan in place, you're going to be in the best situation possible. We're going to have our friends standing 6 feet apart. We're going to have our hand sanitizers and our other controls in place, and we have a plan. They are going to, at OSHA, look at your plan, see if your plan's reasonable, and see if your investigation is reasonable, just like any other OSHA issue. And then they're going to decide whether you should be cited or not. I like to call this the human resources circle of life, just like an EEOC complaint. You got to have a plan. You got to have a policy in place. You got to have the people on board. They've got to understand the policy or the plan. They got to sign off on the policy or the plan. You got to routinely check that people are following the plan. And if someone has a problem here coming forward with COVID-19, then you're going to go, send them home, of course, and then you're going to see what's wrong with your plan. You're going to fix your plan, just like any other OSHA situation, and then you're going to keep following and circling back to make sure that the plan you have in place is working. Now, what do we know about workers' comp and COVID-19? Because one can imagine that our happy workers' comp plaintiffs' attorneys, or claimant attorneys as they're called, in Oklahoma have been busy bees. Yes, there have been some death claims filed. There was legislation that's going to come back up in January that people who are first responders, medical providers, firefighters, or anybody like that, that the employers are going to be nearly automatically liable, or at least have a rebuttable presumption of liability for COVID-19. It hasn't passed yet. It may not ever pass, but I will tell you, if you're a healthcare worker in a hospital and there's one COVID-19 patient in that hospital, you're probably going to have to work pretty hard to prove that that's not work-related. So what kind of things should we look at when we're looking at an employer workplace plan for COVID-19? You should address, obviously, the levels of risk with various tasks and work sites. I mean, it's different between me working in this conference room or me running the window at Wendy's handing out those little chocolate milkshake things. Then you got to look at, because it's hard in a lot of places, especially in manufacturing, where people work on lines and they're so used to working, they're not 2 yardsticks apart. Where are they going to be exposed? Well, if they're standing next to each other in a chicken plant, they're probably going to be exposed unless they're 6 feet apart and they've got on proper protection. So workers that are, like we talked about, when you're evaluating your situation, the public, other customers and coworkers, how close are they? Are you in, do you have someone who got to go to Europe, which unfortunately did not happen to me, and I'm not stuck in France enjoying the weather, and I couldn't get back to the United States anyway. But if you've got individuals who are traveling and they've gone to some place with COVID-19, which is pretty much every place in the United States, healthcare workers who had unexpected exposure to people prior to COVID-19, and if any of you all have been to an emergency room or a hospital lately, that's pretty darn hard to have now. And then, of course, you have to look at non-occupational risks, such as have 3 people in their home have COVID-19, and how do you deal with that when they want to come back to work? Do they attend a church or a singing group or something where several of the people have been known to have COVID-19 exposures, or it would be anticipated that they would have COVID-19 exposure. So you have to kind of take into account all of these when your plans are put into place. Now, here's things that OSHA would like you to have. All employers, we should have good hygiene, which is part of general infection control. The masks and the sanitizers. Now, masks are not meant to replace the big time fit PPE that you're used to, but they do provide some comfort and some resistance to you giving the virus to somebody else. You got to tell, as part of your plan, say, hey, if you're sick, stay home. And I don't think that's been a problem. I think it's what I call a pajama game. It's harder to get the people to come back than it is to make them stay home. And if they've got a fever, they've got a sore throat, if they just don't feel right, tell them to stay home and go get a test, or at least go to the doctor. Now that we're on stage whatever of reopening, we've got to look at the changes that we can make to policies. Can we stagger the workforce so that we can increase that physical distance? Is telecommuting possible? Can we work, 1 week on and 1 week off? Those kind of things. If you're doing telecommuting, please have a written plan in place with every one of the employees that's doing it, because it's been my experience that they never want to come back. And so you need an exit strategy, and you need a way to be able to monitor what they're doing from a telecommuting perspective. And I wouldn't let a telecommuter be an hourly employee. Of course, discourage workers from using other people's phones, desks, tools, and equipment when possible. That may not be possible, so we might have gloves, we might have more hand sanitizers, we might have sanitization of the tools and equipment. Use some type of face covering where social distance is not always possible. And then figure out something to do with the people who are going to be in close areas where they could get the lunchroom. I don't know how else to put it easier than that. You can't wear a mask and eat your lunch. Now, so what people have done, and for those of you that have been to restaurants of late, you mark off tables. You make the chairs 6 feet apart. You do anything you can do to minimize the exposure to other people. Some other additional administrative controls that you might want to think about is what we talked about, telecommuting, both from the perspective of your employee working for you, along with the perspective of the employee working with customers. We talked about extra days or shifts, discontinuing non-essential travel to locations with COVID-19 outbreaks. As I talked to one of our clients yesterday, she's like, yeah, I didn't get to go to Jamaica. That's not essential travel. Well, maybe it is. Okay. But, every place in America has got COVID-19. And if someone comes back from a place that's a hot spot, if you look at the airport in Tulsa, Oklahoma, there's signs all over that says if you have been to, and it lists, for example, New York, you need to stay home for 14 days. New York seems to be doing actually pretty well. Oklahoma, not so much. Develop an emergency communication system, which you probably already have. Set up forums for answering workers' concerns, internet-based communications, just the kind of usual things you do to communicate with your employees. It's kind of like having a daily safety meeting without being near the employees. And you need to keep them up to date on where things are from the CDC perspective, because OSHA is deferring to the CDC. And for example, for those of you that are like me and Mary, who love donning and doffing, which is putting on and taking off stuff, if they have to use really special protective clothing and equipment, how to put it on, how to use it, how to wear it, and how to take it off. And it's got to be easy for them to understand, and you can't remind them enough. And you know what? The reason you can't remind them enough is because guess what? Oh, I'm ahead of myself a slide. Let me go ahead and finish this up. We've already talked about all this stuff with clean, don't touch stuff, have that sanitizer that's 60% alcohol. A lot of small breweries are now selling 60% alcohol disinfectants. They're kind of cute. Regular hand washing, posting signs in the restrooms, kitchens, and other places. Don't touch things. Don't go near your coworkers. Minimize contact to places where COVID-19 may spread. Now, we can get to the slide that I thought we were about. As you would expect, people are already being sued for COVID-19. And this is there have been 2 cases, one out of Cook County, which is Chicago, and then there's been one in California. Let me tell you basically what the people were complaining about. One guy said he hadn't worked for over a month because he'd learned someone at another one of the restaurants has been diagnosed with COVID-19. he learned about the infection from a manager who told him not to report it to anybody else on his shift. But since no one else had been in contact with him, he just decided to stay home. The employees alleged having to work in close quarters with colleagues and customers who might be asymptomatic carriers without proper protection, having to reuse masks or gloves if they got them at all, and if you get sick, don't tell anyone. The workers also claimed the stores didn't have enough hand sanitizers, wasn't on. We have every day, a 10-minute meeting with each shift about safety and wearing protective equipment and what their defenses against social distancing could be. They had signs up. They did everything they could think of as, but for example, workers were saying they were trying their best to wear their masks, but trying your best in a pandemic, as the court said, is not going to cut it. And the one I like the best, they've seen people, their coworkers, not having on masks or gloves, and well, they don't say they've seen much signage. Another lady, even though the place was full of signs, and finally another lady said, well, after I read the part about the 6 feet on the sign, I figured that that's all there was to it, and I didn't read the rest of the sign. So some of that you can't do much about. They did get a temporary injunction instructing McDonald's to do a better job. So what do we learn from the McDonald's case? That you can't do a good enough job, but you can sure try. So you're going to want to have a policy and plans in place. You're going to want to have rules. A couple of the McDonald's actually had a thing where every single employee had to wash their hands at least once an hour, and this buzzer would go off and everyone would run and wash their hands, and then they couldn't go back to work. None of the equipment would work until every single person had basically logged on that they had washed their hands. And so the takeaway from this is have a plan, put it in place, put up a bunch of signs, make all of your stuff available. Someone says, well, I don't want one, I don't have a mask. Give them a blue mask that you get in the box. Give everybody a small hand sanitizer. Have sanitizer stations. Mark off 6 feet. We've all been to places where it says, don't go this direction in the grocery aisle, go the other direction, and people still do it. So while personally we have to take care of ourselves, from an employment standpoint, we're the employers, and we need to do our best job of having plans in place. Well, that's it for me, because it's now time for Mary to talk about the legal responses to COVID-19. And then, of course, please send us your questions, and we'll be happy to answer. Take it away, Mary.
Okay, so thanks, Madeline, for talking to us about safety and plans in place. The other thing that we were asked to talk to you guys about today was the leave laws that have been put in place now. These went into effect in early April, so hopefully you are all aware of these leave laws already. But when it went into effect, most employers were closed down here in Oklahoma unless you were an essential business. And even for essential businesses, many folks were working from home. And so what we have seen over the past couple of months as people return to the workplace is a number of employers having a heightened level of requests for these sort of leaves. So I am going to walk you through the leaves that are in place that are related to COVID-19. Something to remember is that these are temporary rules. There's paid sick leave and then expanded family and medical leave, and they're only in place until the end of the year at this point. Now, what we may find is that they get extended if the instances of COVID-19 continue in the US. Unlike the FMLA, these FFCRA leaves are available to employees who work for employers with fewer than 500 employees. That includes many businesses that have less than 50 employees who wouldn't typically be subject to the FMLA. When you're counting these employees, you have to count it at the time the employee requests leave. So there may be some employers who did large furloughs who were not originally needing to comply with this, but whose employee counts have changed and have made them become be subject to the requirement. You know, if they had more than 500 employees at the beginning but have had to lay people off, that may create coverage where it didn't exist before. Another thing is that you need to also count employees who are jointly employed with other employers, so individuals employed through staffing companies. For large companies with international workforces, you don't have to count employees outside the US. There are exemptions to these leaves for healthcare providers and emergency responders. And in those contexts, the exemptions are really broad. There is also an exemption for small businesses with less than 50 employees, but it is a very limited exemption. It's only available to employers in the context where the employee is asking for leave due to a school closure or a child care closure, and not for the other reasons that the FFCRA leaves apply. I see that I have a question. Let me try this out. Does the 2/3, okay, we're going to talk about the pay on a future slide, so I'll just hold on that one, and hopefully the slides will answer your question. For healthcare providers, like I said, the exemption is really broad. I'm not going to read this to you, but it's basically anyone employed in a healthcare entity. And it's very broad. So those folks don't have to be provided these leaves. However, the DOL did indicate that it hopes that leave will be granted when possible to these employees to help decrease the spread of the virus. So my PowerPoint is not advancing. Let's see if I can get it going again. And if not, I will figure out how to move forward without it advancing. There it goes. For first responders, it's again very broad. Anyone necessary for the provision of transport care, health care, nutrition of patients that are needed for the response to COVID-19, and it includes a large number of individuals as listed here. So your paramedics, physicians, nurses who are already covered by a different kind of exemption anyway. So it is very broad exemption. The exemption for small businesses, however, as I said before, is limited in the context in which the exemption can apply. And in addition to it being that type of leave, the leave due to needing to care for a child whose school or place of care has been closed, the employer has to be able to say that the provision of the Paid Sick or Expanded Family and Medical Leave Act would cause their expenses and financial obligations to exceed their revenues, or that this employee's absence would cause a substantial risk to the financial health of the employer's operations because of that employee's skills or knowledge or business responsibilities. or that just there aren't a sufficient number of employees who are able, willing, and qualified to fill in for this employee, such that the business wouldn't be able to continue operating at a minimal capacity if this leave were granted. So it both has to be that one type of leave, which is to care for a child whose place of care or school is closed, and you have to meet one of these additional criteria. So what are the two types of leave? There's the Emergency Paid Sick Leave Act. It applies to all full and part-time employees, and they're immediately eligible, no minimum period of employment. And this is not all impacted by prior FMLA use during the year, which is different than the expanded family and medical leave that we'll talk about in a second. The types of leave that will qualify are if an employee is subject to a federal, state, or local quarantine or isolation order. So when people have been told, look, we have a stay-at-home order in place, everyone needs to stay at home unless it's a business that's exempted from that, it would apply. The employee has been advised by a healthcare provider to self-quarantine or is experiencing symptoms of coronavirus and seeking medical diagnosis. Note that those top three have one pay provision that we'll talk about. Then the other three circumstances that qualify for the paid sick leave are caring for somebody who is subject to quarantine, or caring for a son or daughter whose place of care or school is closed. And then the sixth one, it only exists in paper right now. It is an employee experiencing a substantially similar condition specified by the Secretary of Health and Human Services or the Secretary of Treasury. They have not specified any of those situations yet. So right now, an employee cannot claim that they are taking leave due to this Section 6, but the government thought, okay, something might come up in the future that we think would qualify, and so we're going to put it in here. Now, to qualify for this paid sick leave, the employee has to both be unable to work and unable to telework. So if an employee can stay and work from home, they aren't entitled to this leave. What the DOL has said is an employee is unable to work if the employer has worked for the employee and the employee is experiencing one of the qualifying reasons from that prior slide. Now, if an employer has to close because they can't maintain operations during a shutdown, then that employee is not qualified for paid sick leave because there isn't work for them to do. That's different than if the employee just has a job that can't be done remotely, but the business is still open. Importantly, employees who are asked to work a different schedule are not considered to be unable to work unless they have one of those other COVID qualifying reasons. So if what you decide is, okay, I'm going to have some people work day shift and some people work a swing shift to promote better social distancing, and that person doesn't like the shift, that doesn't entitle them to this paid sick leave. I think I saw another question too. Let's see. Okay, so lots of questions about use of leave. Some of those will wait until we get to those slides, but here's one question that seems to apply to what we're talking about here. What if you have an employee who has a positive test and the coworkers of that employee who were directly exposed have to quarantine also? Do you have to pay the coworkers as well? The answer is if they are subject to an isolation order, if they go see a doctor and the doctor says you should quarantine since you were exposed, then yes, that would qualify. Now, if it's purely a precaution and they don't have a doctor saying they need to self-isolate, then I don't think that would currently qualify. Now, one of the things to remember is that the guidance that we're getting from the government keeps changing, and that impacts how you answer these questions. So if we get CDC and OSHA guidance that comes out and says, anytime you have a coworker test positive, you need to send everybody else home, and that should be considered a self-isolation order, then I think it would apply. But that's not my understanding of the current CDC and OSHA guidance. And we'll come back to those other two questions in a moment. Every time I do this, it locks up my screen. Okay, how do we get back to intermittent use of paid sick leave? So paid sick leave must typically be taken in full day increments, because if somebody is staying home because they are sick or have been told to stay home, they aren't going to be allowed to come in for half the day. Or if they're staying home to care for a family member who is sick, the government also doesn't want them coming in. My screen is jumping around. So I apologize. So if they are caring for someone who's sick, you're not going to have them come in intermittent leave. However, if they can care for someone who's sick from home and then telework part of the day, but they can't work a full day because of the teleworking or because of caring for someone, then that might be a case where intermittent leave would be appropriate. The other place is where they're caring for a child whose school or daycare is closed. Then intermittent leave can be used, but that's only upon agreement between the employer and the employee. I'm trying to make sure we haven't skipped anything. I'm sorry. Madalene, did we already talk about unable to work or telework?
We did talk about telework, but
I think we've done this screen.
yeah, but not the different schedules.
Oh, we did talk about that. So how much paid sick leave and at what rate? Okay, so they get 80 hours of paid leave if they are a full-time employee, and that's their regular schedule. If they're part-time, they're entitled to be paid for the number of hours that they would have worked per day during the prior 2-week period. Sometimes that's not going to be a constant, because this person really works kind of on an as-needed basis. And when that comes up, the regulations do have a somewhat more complicated way of calculating what that employee would be entitled to. I told you before to pay attention to those reasons for paid sick leave, because it indicates the rate at which people have to be paid. This slide talks about that. So if leave is taken for reasons 1 through 3, which are basically the employee's own illness, it gets paid at their regular rate of pay up to $511 per day and $5,110 total. If leave is taken for reasons 4 through 6, which 6 doesn't really exist right now, so it's really just 4 and 5, which both relate to caring for other individuals in your family, then the pay is at 2/3 the employee's regular rate of pay, up to $200 per day. Well, we really did jump around. Okay, now I think some of these questions are now, does the 2/3 pay apply to the first 10 days of EFMLA? If they're using FFCRA paid sick leave for that first 10 days, will the 2/3 apply to that? Or does the 2/3 only kick in after that first 10 days? So we haven't gotten to the EFMLA, the expanded FMLA yet, but as we just said, one of the reasons you can use paid sick leave is to that same school closure or lack of daycare situation. And so if the employee chooses to use paid sick leave to cover those 10 days, then they will get that 2/3 pay. But you could have an employee say, hey, wait, I'm going to take those 10 days unpaid. I don't want to use my paid sick leave because I want to keep it in case I get sick later. And I'll get paid a higher rate if I use it for my own sickness. So I'm going to wait. Now, I don't know how closely employees are reading your posters that you need to have up on this, but if they're reading it closely, that would be a reasonable response to how they want to use this leave. So they can use the paid sick leave, but once they've used it, it's a one and gone. So if they use it at that 2/3 pay because they use it for the first 10 days of a school closure or a lack of daycare, and then they get sick, it's gone now. They don't get to go back and get, you know, the difference between the two rates or a new set of the 80 hours. It's once and done. The next question is, an employee has already exhausted 80 hours of FFCRA paid sick leave due to running fever on multiple occasions since April 1 and being sent home for testing. Once again, the employee shows up with fever, stomach issues, and is sent home for another test. Can we require the employee to use his/her own accrued time, or do we have an obligation to pay the employee out of the company's pocket since we sent the employee home and won't allow the employee to return until after the test results are back? If the employee has accrued time, you can require the use, and that is not dependent on whether they are exempt or non-exempt. However, if you have an exempt employee who you choose to send home and they don't have FFCRA paid sick leave left, and let's assume that they've already used all their accrued time, in that case, you'll want to talk to your employment lawyer, but in general, you may have a real problem if you don't pay them for that time, because remember, exempt employees have to be paid their full salary for any week in which they do any work, unless they absent themselves for a personal reason. When you have accrued leave that can cover that, you can dock their accrued leave, but you can't dock their pay. So when you are sending them home for the business's purposes, you're in a different situation than if they were saying, hey, I want to take a couple of unpaid days to go on vacation. So be careful with exempt employees if they don't have that accrued leave. What if a pregnant nurse is required by doctor's office hospital to work? 7 months pregnant, and recently CDC says they are at risk. Hospital is, there's a word that I don't know what it was meant to be, something nurse, making nurse work. Is this legal? You know, that's a very specific legal question that probably I need more facts to answer. So this is one that we should probably take offline. Is the employer required to pay an employee if the employer initiated the isolation order? The employer initiated the isolation order and required the employee to stay home due to them reporting that they attended an event where they later found out an infected person was in attendance. Okay, so the reasons for paid sick leave do not include isolation orders ordered by an employer. So the paid sick leave is isolation orders by state or federal governments or municipalities. But I think this goes back to the answer I gave earlier. If the employer says, hey, I'm going to send you home, they may not be entitled to the paid sick leave unless their doctor then says, yeah, I agree this person should isolate because they're exhibiting symptoms or something. And if it's a non-exempt employee, not paying them for time not worked wouldn't be a problem. But if it's an exempt employee, then the answer I gave before about being careful would apply. So expanded family and medical leave, it is really very limited. It only provides expanded coverage under the FMLA when an employee is unable to work due to the bona fide need to care for a child whose school or child care provider is closed or unavailable due to COVID-19. All employers with fewer than 500 employees must comply unless they're one of those small employers that has an exemption. Again, it's counted at the time the employee requests the leave. This coverage is broader than the FMLA in that there's not the need to have 50 employees within 75-mile radius. Also, the employee only needs to have been employed for at least 30 days, not the full year. So even though this is considered a type of family and medical leave, you need to be thinking about it even if you're not a typically covered employer, and even if the employee doesn't meet the normal requirements for FMLA. And this type of leave is impacted if the employee has prior use of FMLA time. So employees are only eligible for a combined total of 12 work weeks of FMLA and EFMLEA during the employer's 12-month period, however you define that under the FMLA. So if an employee has already taken, before COVID hit, they were out on the leave and they already used all 12 weeks of FMLA, they're not going to be eligible for any EFMLA. And if an employee goes, that pregnant employee that was the source of one of the questions, if a pregnant employee knows they're going to need to use maternity, FMLA for maternity leave, but they take EFMLA at this point, they would have a limited amount of FMLA later. But again, remember that the expanded FMLA does not cover the full range of reasons that the expanded sick leave does. It's only about that caring for children whose school or place of daycare is closed. One thing to note, during this summer season, the DOL did come out with some guidance to tell us that, hey, look, if your employee had summer camp plans for a child and that summer camp is not going forward due to COVID, that does qualify under the FFCRA as a legitimate reason for the leave. As we talked about earlier, the initial 10 days of EFMLA are unpaid, and an employee can elect to utilize existing paid leave concurrently with the 10-day unpaid leave period, but the employer cannot require this. And as we already discussed, employees can use the sick leave to cover those first 10 days if they want to. The rate is 2/3 of the regular rate multiplied by the number of the hours the employee would normally work. Like I said earlier, in regard to paid sick leave, if this is unpredictable, there's a calculation that is in the regulations looking at the prior 6-month period to determine the average number of hours. Pay under the FMLEA is a maximum of $10,000, total $200 per week. Now, in regard to documentation for reasons for leave, employees really have minimal documentation requirements. They have to provide their name, the dates the leave is requested, the qualifying reason for leave, and a statement that the employee is unable to work or telework due to the qualifying reason. Note that nowhere in here does it say that they have to produce a doctor's note. In fact, the CDC has said you shouldn't be asking people for that because it's too hard to get. Doctors' offices are too busy. That's really the basic. Now, if they say that they are quarantining due to a quarantine or isolation order or to care for someone subject to that order, they're also supposed to give you the name of the government entity or the healthcare provider that gave that order to them. If they're requesting leave to care for a child whose school or place of care is closed, the employee is also supposed to give you the name of the child, the name of the school or the place of care, and a statement that it's closed or unavailable and why no one else can cover this. The other thing that's not in the regulations or the DOL guidance, but has come out in IRS guidance, is that if the child is over 14 and the care is being provided during daylight hours, in order for the employer to get the IRS tax credit, the employer also has to gather information from the employee about what special circumstances exist that require the employee to provide care for the child. In other words, the IRS is saying, look, if your child is over the age of 14, during the day, they shouldn't need parental care absent special circumstances. And so it's unreasonable for an employee to say, oh, I need to stay home to hang out with my 15-year-old who sleeps all day and doesn't want to talk to me anyway. Or at least that's my house. So if you do have employees who are asking for this type of leave, make sure you find out the age of the child, and if it is a child over the age of 14, that you're gathering that additional information. If you don't gather that information, the employee is still entitled to the leave. You just won't get the tax credit. So you want the tax credit if you're providing it. The final one, Madalene, do you want to take this over, or do you want me to just speed through?
Speed through, Mary.
Okay, so the last thing we wanted to remind you of is the Oklahoma Senate Bill 1946, which provides immunity from civil liability for people in state court relating to individuals who claim they were exposed or were potentially exposed to COVID-19 in your place of business. Now, note, this law does not provide immunity from workers' comp. Madalene talked to you earlier about, well, there may be something like that in the works. Employees are going to have to show that it was somehow work-related, and depending on your work environment, how hard that will be is going to be, very, very different depending on the work environment, right? If you run a grocery store or someplace with a lot of contact with the public, I think it's going to be not too hard for them to say this was work related. But if they work alone in an office with no exposure to the public and you haven't had any COVID-19 in your workplace, the first question in that deposition is, how many bars did you go to? Did you go to any mass gatherings, birthday parties, political protests? Like, where were you in that time? And a lot of people may not have that coverage. But for non-workers, this law provides civil liability immunity, but there is a caveat, and a pretty big one. You only have immunity from civil liability if you were following applicable state or federal guidance for COVID-19 at the time of the alleged exposure. So one of the big questions is going to be, let's say that in your business you've had a lot of employee resistance to face masks. It's a very political issue. A lot of people have taken a position that they just don't want to wear them. If you decide, okay, we don't want to have this fight, but we know that CDC and now OSHA are saying, yeah, face masks should be worn, is that going to take you out of this immunity? Potentially. So you need to really be making sure that you're following the CDC guidelines. Now, the lawmakers did incorporate this provision that if there are two or more sources of applicable guidance and they conflict, as long as you're following one of them, then that's enough to get this liability. So, where I really don't know what's going to happen is these face masks, right? I mean, we've had differing guidance over time. Right now, the federal guidance seems to be coming all in line with each other finally and saying, okay, yeah, people should be wearing these, but we don't have any guidance from the state. Now, we don't have guidance from the state saying don't wear them. So if the state is silent and the feds are saying it, I think there will be a fair number of plaintiffs' attorneys out there saying, if you weren't requiring that, you don't get the liability. It will ultimately be up to the courts to decide how that plays out. Madeline, your fireworks aren't there.
I know. Well, it's because you have to ask the powers that be. I wanted us to have fireworks, but unfortunately, they do not appear. We still have a couple of questions unanswered, Mary.
Okay, I'm trying to get there. It's just not showing up on my screen. Okay, there it is. So one of the questions, what if you pay an employee 2 weeks to quarantine due to exposure, and then they actually become ill and have to stay home again due to the illness? Do we have to pay them again, or have they maxed out at that point? They have maxed out, you just get the 80 hours. So now, maybe you have other sorts of paid leave you can let them use, but the required paid leave is a once and done. Next question, if we did a precautionary shutdown of 1 week due to a positive test, could we allow employees to take 40 hours of their paid sick leave? If we gave the employees the option to use or not use their paid sick leave and didn't make it mandatory to take the paid sick leave? I think you could provide it, but I would question whether you would get the tax credit on the back end. I mean, there's no harm in providing the pay, but if you're wanting to get the tax credit, you've got to show the request from the employee and the qualifying reason. Well, the precautionary shutdown is not reason one. It's not a state or federal order or quarantine order. It's not an order from a doctor, and they're not staying home while they're getting diagnosed for COVID. And so I think that if you did that, you would have an issue with actually getting the tax credit for those 40 hours on the back end. Next question, while on the clock, can we force COVID tests to be taken? Somewhat of the same concept of forcing drug testing. Yes, right now, you can. The EEOC obviously weighs in on these sorts of things because any sort of medical testing at all is considered a medical examination, and under the Americans with Disabilities Act, you normally can't do those for active employees unless you have a legitimate, it has to be a kind of heightened business reason. They have to be posing a direct threat to themselves or others. But what the EEOC has said is that in the context of COVID, people do present a direct threat to others. And because of the widespread nature of it in all of our communities right now, this is okay. So yes, you can do testing right now. What I just want everyone to remember is this is a product of the time in which we are living. And if we get to a place where it is not widespread, that very well may change. So don't take it as this is always and forever going into the future. It is right now, it is okay. The other question is, can employer require an employee that traveled to a hotspot to get tested before returning to work? Yes. Now, remember that if it is a non-exempt employee, there's no real duty to pay them during that time unless they meet one of the criteria for the paid leaves we've talked about. If it's an exempt employee, remember that you have to pay an exempt employee their full salary for any week in which they do any work. And so if this is going to cross work weeks, you may have to pay them for the whole week where they already started and did some work. And if it's going to be a prolonged absence, you may want to block them out of all programs for a full work week, so that, because if they don't do any work in a work week, then you don't owe them their salary. So definitely something, if you have exempt employees that you're trying to apply this to, where you may want to speak with your employment gurus, your FLSA gurus, to make sure that you're implementing it correctly. Another question is, what if you have an employee that has a doctor statement that says the employee cannot wear a mask? you may need to make a reasonable accommodation for that employee not being able to wear a mask, but you also still have the duty to protect your other workers. So you're going to have to be creative about this employee's work environment. Maybe they normally, maybe they have to work a different shift. You know, if it's a file clerk, maybe they need to come in when nobody else is in the office so they aren't passing people in the hallways without wearing a mask. And, you know, maybe there are other sort of controls that you can put in place that would help protect other workers and this worker, even though they can't wear a mask. I was actually in a coffee shop recently, and there was a sign up that said, so-and-so, name of one of the baristas, has a doctor's note indicating, or no, has a health condition indicating that she cannot wear a mask. If you would like a different barista to serve you, please let us know. I would say to that employer, I sure hope you got consent to talk about her health condition with your customers before you posted that sign, but I'll give them the benefit of the doubt and believe that maybe they talked to her and said, hey, look, we're gonna have customers offended by this. Are you okay with us sharing that so they understand why? Otherwise, you know, it's a coffee shop. We're not gonna be able to give you any hours because we want all of our baristas wearing a mask. I don't know, but I think that there are often ways around it, but it's not just an automatic, no, everyone has to wear a mask, because you have to make accommodations. But if you're not going to have the person wear a mask, you also have to think about what are you going to do to protect that person and other workers. So the last question I have is, we are a manufacturing company. Reducing the number of staff would not allow our essential business to serve the public. It sounds like I could have a workman's comp liability if an employee came down with COVID-19. Is that right? I would think yes, but I will say that Madalene does a lot more workers, or used to at least do a lot more workers' comp than me, so I'll let Madalene answer that more thoroughly.
I think that this is going to become one of those deals based on the OSHA guidance that we've seen so far on if it's you got to work with the public job, you're going to have to be able to prove that this person got COVID-19 somewhere else. And if they are in one of those protected groups like first responders or, I mean, Walmart greeters, to use a generality, you're going to be stuck. So I don't know what to tell you. You're just going to have to take, I mean, I'm seeing plastic shields between people and the public. There's lots of different things that people can do.
Oh, if it only all invested in plexiglass a year ago.
That's right. We should have done that, Mary. But I think I'm not really sure what the heck you do except do the best you can, and do the increased hand washing, increased testing. That's definitely a place I'd take everybody's temperature when they came in the morning. Yeah, I mean, even that's what the McDonald's case shows us. I can't think of anything McDonald's didn't do, but obviously judge up in Illinois thought they could do more. So I think in that case, maybe you get them face shields, because that's the next step above a mask. So you just have to do the best you can.
And I have seen some Walmart greeters who are wearing the full face shields now. So I don't know, not all of them are, but I think that, people are definitely, I know at my local retail establishments, we've seen the plexiglass barriers between them and the customers and between each other, right? Between workstations where cashiers work back to back, big plexiglass, wearing the full masks. One of the questions we got also, if masks are required, should employees that refuse to wear one be sanctioned with disciplinary action? You know, that's going to be a choice that you have to make, but I will say that if you do not take action against those employees, that your safety plan may be subject to attack. And so now, all of that with the caveat that if somebody comes to you with that doctor's note that we talked about earlier, now you've got to accommodate them. But yeah, if you're not enforcing your face mask, if you know someone isn't wearing it and you're not taking action, and some employers have more options, because you might have an option of saying, hey, look, what's your deal here? And let's say that employee can work from home. And you don't mind that employee working from home and they're productive from home, and they just have like a political issue with wearing it. Okay, maybe you're going to let them work from home, but for most employers, if they're in the office, you need them in the office, you need to be enforcing it. Otherwise, if you do end up coming down with some sort of cluster, there's going to be a much higher level of both, you know, other people being able to claim that it's workers' comp, and or, you know, OSHA getting involved and saying, hey, you weren't enforcing your policy. We're getting more questions as we go.
Can I add something, Mary?
Absolutely, please.
If you have a safety policy in place that says, if you don't follow our safety rules, you're subject to discipline up to and including termination, and you've determined that the safety rule is a mask, absent a doctor's note, I think you can send that person home or suggest they go someplace where they don't have to wear a mask. And I understand the First Amendment business, but you can't yell fire in a crowded theater, and I'm not sure you have a First Amendment right to infect other people. But I'm not going to get in the middle of that, because my husband wishes that I would stay home and wear a mask near him, and I'm more than happy to wear a mask whenever I see him. So, but in any event, yes, I think you need to implement and be serious about your safety plan.
The next question is, if we are an environment and we know a patient has been to a high incident area, so I think there's a word missing there, i.e. Arizona, can we require a customer or patient to wear a mask while in the office? We are a small office. Yes, I mean, you may get pushback from clients and customers and patients. And different businesses have reacted differently to that. For example, Costco says, if you don't want to wear a mask, we don't care if you don't shop with us. Go shop at Sam's. And they actually put that on one of their social media posts, which cracked my girls up. So, you know, some businesses are pretty militant about it. I was just in Colorado on vacation. They were being very diligent in their mask requirements, which were required by a municipal law. But I was actually in a store when somebody tried to come in without a mask and got fussy with the person who was running the shop. And the person just said, well, I will call the police and they will throw you out. Alternatively, you can walk out to the sidewalk and call me, and I will place your order remotely and deliver it to you outside, but you're not allowed in our establishment without a mask. So, you know, it's a really hard decision when you're talking about your patients, your customers, your clients. You don't want to alienate people. People have really strong feelings on this. So you're going to have to make a decision there, but yes, you are allowed to. No, there is not. If you talk to any lawyer, I've yet to hear any lawyer say that there's any sort of constitutional right not to wear a mask. I can't find it. Now, I'm not a constitutional scholar, but I don't think that exists. So you can tell people that. Also, you're not a government actor, probably, which constitutional restrictions, you can tell people they can't have certain speech in your place of business, even though the government can't always do that. I think that is all of the questions. Do you see any that we missed, Madeline?
Did we get the question about the person that got to go on vacation to Mexico
No.
at the bottom?
Okay.
We are a manufacturing company. Did you see that one?
No, I didn't get that one. Okay, but now I see it. We are
a manufacturing company. We have an employee. Okay, you want to, no, you go ahead and do it. It's in your department.
Okay, we have an employee taking a personal vacation to Mexico. We are following CDC guidelines and will require him to quarantine for 14 days when he returns. Does this qualify for the FFCRA paid leave? The only way that it would it be if the CDC currently has international travel as a mandatory self-isolation for 14 days upon return. I don't think that exists right now, but I have not looked it up in the last couple of weeks. But you know, if you think back to when the whole country started to close down in March and people were returning from Europe and places in Asia, and the government said, you need to quarantine for 14 days upon your return, those people would qualify for the leave. If right now there's no such government mandate for people returning from Mexico, then, and honestly, right now we have a higher transmission rate in the US than any other country, I think. So I'm not sure that our government's putting a lot of restrictions. It's other countries that are putting the restrictions on us. That if there's not a government order saying that people returning from Mexico need to self-isolate, then no, it's not that paid leave. And in fact, you know, I have helped multiple employers with policies about travel, because sometimes you can allow someone to have that week off, but when it becomes 21 days that they're not going to be in the office, that just isn't reasonable for this employee to be gone. And so for some employers, the answer is, you know what, your vacation request is being denied because what you are planning to do will actually require you to be away from the office for 21 days, and we can't have that amount of time away. That's a not popular policy to put in place, but I'll tell you multiple employers have, because you know, if this is a worker who can't work remotely well and who you need to not have 21 days off, you know, maybe this is not the time for them to be traveling to Mexico. A question someone said is, will these slides be made available to us? Yes, the interesting thing about our remote world is that we can't just hand you copies. Our marketing person, Stephanie, who talked to you guys at the beginning, is nodding yes and giving me a thumbs up. Stephanie, can you tell me how they will get them? There will be a follow-up email to all of the participants tomorrow that will have these slides, which is great because then you can look at those definitions and all of those reasons.
And I believe that you'll also, if you want to really terrorize yourself, this will be available to watch again on our website. Is that right?
Yes, I got another thumbs up.
And thank you for the people saying thank you.
Another question, if I require a non-exempt employee to stay home because they have a family member who tested positive for COVID or sick with COVID, do I have to pay them because I am requiring it? Well, we have our exempt versus non-exempt issue that we've already dealt with. I think this question is really going to, does it qualify them for the paid sick leave? It would qualify them for paid sick leave if they request it. But if they don't want to take the leave, but you require it because it's in their home,
let me tell you my opinion. It's probably cheaper to pay them than to pay us. Although paying attorneys is, what we live for, it is probably cheaper to just pay them when they stay home with their sick family member than to have to explain why you didn't want to let somebody stay home with their 88-year-old mother with COVID-19. I think that sometimes it's dollars over rules.
I think the question might be, though, what if they don't want to take it? Like they specifically don't want to take it because they're saving it in case they get sick, because they get paid at a higher rate if they use it for their own illness than if they use it to care for a loved one. So I think it could potentially be a violation of the paid sick leave to require them to take it for one reason instead of allowing them to decide. But Madeline's point still holds true, that even if you can't get the tax credit for it, maybe just paying them would be the better way to go. Of course, if you are an employer in a community that's been highly impacted, the effect on your bottom line could be significant. So definitely a hard choice to make there, and something that you'd need to look a lot at the specifics of your situation to know. Oh wait, Michelle, I think this relates to that same one. Let's see. So when you guys send in comments, they don't all appear right next to each other. So yeah, so then that on that same question, we got a follow-up that said, what if I am paying them full rate anyway? Well, then you're doing what Madeline said, you just may not get the tax write-off. What's the statute of limitations for an employer mischaracterizing leave, e.g. forcing an employee to take vacation while caring for a seriously ill family member? I believe that it incorporated the paid, it depends on which leave that you're requiring them to take. If it is the paid sick leave, that incorporated the provisions of the Fair Labor Standards Act, which has either a 2 or a 3-year statute of limitations, depending on whether the plaintiff can show that your violation was willful. If they can show that, they get the longer 3-year statute. If it's the, and I think that's what this person was asking, just a note that if what you require, if you mess up the expanded FMLA leave, that incorporates the FMLA statute of limitations. Does it have the same willful, or is it always 3 years, Madeline?
Well, I think it goes to whether the lawsuit's being brought by the Department of Labor versus an individual. And if an individual is bringing it, they may have a shorter time period. It's at least a year. It could be, what we're talking about probably doesn't apply, Mary. What you and I are thinking in our FLSA brains is that there's no look back period because it's not a wage issue.
No, I was talking about the FMLA statute of limitations.
Right, but that's what I'm saying is that it wouldn't be, I think it would be the at least the 2-year.
Okay.
Could possibly be a 1 year. There's some odd things that have 1 years. So I can't remember looking at that. Just don't throw your papers away. That's the best thing I can tell you. And if you'd like to, we could, if you'll send us a private email, one of us will find the answer.
Yeah, absolutely.
To that statute of limitations question. And that's probably safer because we would hate to give you, statute of limitations are very serious to lawyers and we're scared of them. So send us a private email so we don't mess you up.
Well, I think that's all the questions we had. I don't see any new ones, and we're already over by about 25 minutes, so we'll let you guys get back to your day. Thank you so much for joining us and for all the great questions.
And have a safe and happy 4th of July.